It's been such an interesting afternoon listening to the presentations, and it really flows very nicely into what I'm going to talk about today. And as Barbara was saying, it's interesting how all of these different topics actually do relate. And the other thing that's interesting, I think, is I was looking at Barbara's pictures of where she comes from. This is a picture of where I come from, which is the other extreme in Australia, which is the city of Melbourne. And it looks very nice in that photograph, but it's very cold here at the moment. It was 2 degrees this morning. And for a number of years, I actually lived up in Townsville, where my colleagues were Alona's from, and Alan is actually located even further north, where it's always beautiful and warm. So, and it's a great pleasure to be speaking to you today. I've presented at the last conference, and we have a really a relationship that we really enjoy with IIHS. So we're always really very pleased when we get the opportunity to engage in events such as this. So who am I? Who am I to be talking about this particular topic, which is the role of professional standards or practice standards in nursing? I am, as was mentioned, a Professor of Quality and Strategy at James Cook University. I was formerly the head of school, and I realised today that I've actually been nursing for 40 years. Now, you're all thinking I must have started when I was 2 years old, but yeah, Alan's nodding. Thank you, Alan. And actually, for 30 of those years, I've actually worked in academia. So the reason that I moved quickly into education is I have a great passion for nursing, and I think it's a real privilege to be a nurse. And I am interested in the role of professional standards in not only the work we do, but the education of our future generations. I have a particular interest in workforce and how educational programs prepare the future workforce. And at the moment, I think we all know, probably in no time in history has the nursing profession been under so much pressure. But I think, as Alan alluded to, it's also a time where we've got a great opportunity to advance the profession. As Barbara pointed out a number of times in history where nurses have had opportunity to surge forward and shown what we're capable of, and here is another one of those times. What I want to talk about in this session is I want to discuss the purpose of professional standards generally, and talk about standards that impact on our practice, that come from different parts of society, different parts of government, different parts of the regulatory authority. And I want to examine in particular the processes we use to develop standards for practice and how these standards for practice are applied, and some of the limitations that we have, or a bit of a critique of that. I'm using the term professional standards quite generally here. Professional standards can take many forms, and as you can see, the role of them essentially is to protect the public. Usually these professional standards are developed by organisations such as nurses' boards or councils, and the role of nursing boards and councils is actually the protection of the public through the registration and regulation of nursing practice. So these organisations produce documents to support that. Depending on what they are, because as I'll talk about in a moment, they take different forms. They either establish a baseline for practice, or they're the aspirational ideals that we aim for in practice. They guide our behaviour. They guide the way we carry out our practice. And ultimately, through having professional standards, we're able to raise the status of the profession. Because if you look at the criteria for being recognised as a profession, always it involves autonomy, and it involves having regulation that's self-managed. And these guides, professional guides and standards, are the part of the mechanism for doing that. So when we talk about professional standards, in nursing, what are the professional standards that impact the way we work? We have, depending on what part of the world you're from, you may have one or more of these. They may be combined in some instances. For example, in the United States, I believe they combine their professional standards with scopes of practice, and I'll talk about the distinction in a moment. In Australia, we do have codes of professional conduct and codes of ethics. The distinction between a code of conduct and a code of ethics, really the code of conduct is the floor. That's the basis from which we should practice, whereas codes of ethics they're the aspirational component. They're the things that we actually ideally should be achieving. And there's a lot of factors that influence whether or not we're able to do that. In Australia, we also have decision-making frameworks which influence our practice. Some countries still have competencies to guide nursing practice. We don't have them anymore in Australia. There's a reason. The reason that we moved away from that is because they're much more granular. They actually look at specific skills and behaviours, and that's not always ideal, as I'll discuss in a moment. Depending on what part of the world you're from, these different professional standards will take different forms. I used to work in one third world country where in their code of practice it actually said the nurse will not steal from the patient, whereas in where we come from, you wouldn't have to say that because that's a standard that applies to society generally. So you certainly wouldn't have to say it to nursing because it's inherent in the nobility of the role. The other types of standards we have our practice standards, which I'm going to actually drill down into a little bit because I think they're important for us to consider when we talk about the role of professional standards and the regulation of nursing. Some of the other standards, though, that influence our practice that come from other sectors are the National Safety and Quality Health standards in Australia and the Aged Care Quality standards. And the other standards which influence a lot of what we do in nursing, but they shouldn't direct practice necessarily, are the accreditation standards that determine the quality of our undergraduate and our pre-service nursing programs. So I'm going to focus now on practice standards specifically, as that's the topic of this conversation. What are practice standards? Well, practice standards are documents that articulate the principles of practice. They establish benchmarks, and they are intended to reflect the expectations of both the profession, so what we expect of ourselves, but also what the public can expect of nurses. Now, some subspecialties such as mental health or critical care nurses will have subspecialties which have their own standards of practice. But in Australia, we have a set of standards that apply to all registered nurses in all practice settings because their intent is to be much, much more generic. What are they not? Well, as I mentioned, they're not competencies. Competencies are about safe and effective performance of skill of behaviour, where a standard is actually what the nurse aims to achieve by performing a skill or behaviour competently. The way that some competencies are written are so specific that nurses who work in particular areas might think that those competencies don't apply for them, so they tend to pick and choose like a smorgasbord from the competencies. They often are quite narrow in their application rather than the broad standards that we are looking for when we want to guide nursing practice, because nurses work, as we all know, in very different contexts, and we need a set of standards that will be adaptable to all different standards. As an example, when we first started educating nurses back in the hospitals, we used to train them. We don't talk about training nurses anymore, we talk about educating them. But when we used to train nurses in hospitals, we used to look for task performance. We used to look for the ability to perform a task well. And what happened was when those nurses then graduated and went to work in different contexts, they weren't able to transfer that knowledge. Now we look at teaching our students principles. We talk about principle-based education so that when students graduate, they can transfer that knowledge. And maybe they won't be an expert in all of the tasks, but they've got a principles base and a critical thinking ability that will enable them to apply their knowledge and expand their knowledge into the future. Standards for practice, people talk about standards of practice, and I think in some parts of the world they do actually call them standards of practice. To me, there's a difference because the standards of practice, it seems like it's a finite, similar to a competency, it's a directive, whereas standards for practice are actually guidelines. They're much more flexible in their application. The other thing that standards for practice are not is a scope of practice statements. Scope of practice is one of the most misunderstood elements of nursing practice. people, I think, nurses that I work with think that there's a book somewhere that actually outlines your scope of practice, and there isn't. Because if we want to prepare nurses to work in a variety of different contexts, it would be impossible to identify what the scope of practice would be, what would be all of the tasks that they would essentially perform in those different settings. And so standards for practice give us much, much more, ironically, scope for nurses who work in different contexts. And I'll talk a little bit about the example of Australia. We have what are called the Registered Nurse Standards for Practice. The Nursing and Midwifery Board of Australia produced these. We used to have competencies until 2016, and we got rid of those for the reasons that I've mentioned, that they were too limited, too prescriptive. And the other thing about competencies is that they were largely developed as baseline standards for practice for graduates from nursing programs. So they really weren't applicable to more experienced nurses. The competencies, the standards for practice, as it says there, the Nurses Board determined that they should be evident in current practice and inform the development and inform the scopes of practice and aspirations of registered nurses. What's interesting is that the scope of practice, the standards for practice that we use in Australia contain reference to evidence-based practice, advocacy and leadership, which is what our speakers have been talking about today. Where did the standards for practice come from? In Australia, before 2010, we used to have state-based nursing boards, and the state-based nursing boards would control practice in their jurisdictions. This was really quite difficult because if a nurse worked in Victoria, for example, and wanted to go to New South Wales, they had to apply for registration, pay a fee, perhaps jump through a hoop, pass a test. Given that we're an island continent, it was really quite strange that you couldn't practice nursing anywhere in the country without getting registered if you crossed a border. So after 2010, through the establishment of the Australian Health Practitioner National Regulation Law Act, it's a mouthful, we saw the establishment of the Australian Health Practitioner Regulation Agency, or AHPRA as we know it, and the National Regulation and Accreditation Scheme. And establishing those two bodies actually had a huge impact on the development of standards of practice, because the Nursing and Midwifery Board of Australia was established under the auspices of AHPRA, and the registration and accreditation standards actually determine that a registering authority such as the Nursing and Midwifery Board of Australia needs to establish standards for practice. They need to have standards for their professional group to enable us to ensure that we have that quality of practice. The standards for practice in Australia were developed through quite a complex process. As you see there, it had 3 stages, but it was essentially, there was a literature review conducted and then consultation with key stakeholders in nursing. And then the research team that developed them conducted extensive observation of nurses in practice to develop these standards. From there was consultation with external stakeholders and other internal stakeholders, and then once they were developed, they were validated through another round of observation. I was fortunate enough to be on the team that developed the midwifery standards for practice. I'm not a midwife, so basically I just made the tea and took dictation for the group. I did a bit more than that, but I clearly stood out because I wasn't a midwife in that context. But the process that we followed was very similar to this because this was actually quite groundbreaking in its approach. What came out of that research and that project was our 7 standards for practice. And as you can see from this diagram, these standards for practice are interwoven, and that's how they're distinct from the competencies that we had previously, because you can't pick and choose from them. When you adhere to one, you're automatically required to adhere to others, and it stops at picking and choosing. And as you can see, they're quite broad. So they don't talk about, you should be able to wash a patient or you should be able to feed or administer medication. They're much broader than that. How are they actually applied in practice? In Australia, one of the biggest uses that we have for them is in the development of education programs. The accreditation process for us requires that standards for practice are visible right the way through our program and are used as a measure for ensuring that graduates are ready to practice. They form the basis of our clinical assessment tools as well. And in fact, in our curriculum at James Cook University, they form the basis for our course learning outcomes. Another way that they're used is to identify where there's been a breach. So if someone is claiming that a nurse didn't perform to an appropriate standard, it's this standard that we're talking about. So if a nurse is charged with misconduct, for example, these standards will be brought out to see whether or not they have performed, along with other documents and other professional standards. I think during COVID, it's a really good opportunity. We're not using them, I don't think, adequately in practice. And during, as we struggle with this pandemic and the reduced resources that we've got, so they're a really good touchstone for us to actually access and see whether or not our practice is actually still achieving the standard that is outlined in these documents. I thought I'd just do a little bit of a critique of them to finish up. And it's really just questions around them. I do wonder whether or not nurses in Australia really understand their purpose beyond them being something that they have to achieve in order to pass their program of study to register. Because the old competencies were very clearly the graduation standard, I think a lot of nurses still see the standards for practice as being simply for that purpose. So I don't know, in fact, that, as I mentioned before, that the profession is using them as they are intended to be used, which is to provide that high level of guidance in practice. Some may think they're too broad because they're so abstract they don't give direction, and some might think they're too narrow because in some parts they do provide they're quite dictatorial about what it is that a nurse is expected to do. And that might mean that they're not future-proofed. And by future-proofing, I mean, how are they going to withstand the changes that we are seeing now and the changes that we're going to see from what is being quite a significant time of change for the profession. And that's all I have to say. Thank you so much for listening, and I'll be happy to take any questions when we get to that point. Thank you.